A virus that refuses to die. What if COVID mutates again? The pandemic may have slipped from the headlines, but the story of COVID-19 is far from over. Like a ghost that refuses to rest, it lingers, waiting, watching, evolve, and it has already claimed more than 7 million lives officially, with excess deaths possibly double that. Families were torn apart, businesses collapsed, entire nations brought to their knees. And just when the world thought the nightmare was ending, new variants appeared. Delta, Omicron, each one faster, stronger, slipperier, each one forcing the world to relive its trauma. Now experts whisper a chilling question: what if COVID mutates again? Not if, when. The mutating monster. Viruses are machines of evolution. Each infection is a chance for the virus to rewrite itself. In India 2021, the Delta variant burned through cities, killing thousands a day. Crematoriums overflowed. Entire neighborhoods smelled of smoke from funeral pyres. In New York 2020, refrigerated trucks lined the streets filled with the dead. That was just the beginning. In Brazil, entire generations were wiped out in weeks, with cemeteries forced to dig mass graves. These horrors came from mutations, small errors in genetic code that made COVID more efficient. The virus does not need intent, only opportunity, and humanity gave it billions. A gallery of the dead. The pandemic was not only numbers, it was faces. In Italy, March 2020, the mayor of Bergamo wept on television as army trucks carried away coffins because morgues were overflowing. In the US, Broadway actor Nick Cordero died at just 41 after months on a ventilator. His wife chronicled his decline on Instagram, shocking millions. In Indonesia, thousands of frontline doctors and nurses perished, sometimes with nothing but plastic raincoats for protection. These stories are not ancient history, they are warnings carved in grief. The expert warnings. Epidemiologists fear 3 nightmare paths: a faster virus. Omicron already spread at lightning speed, but speed has no ceiling. Imagine a variant more contagious than measles moving through classrooms and airports before symptoms appear. A deadlier virus. In Brazil, Gamma and Delta filled ICUs with gasping patients. A mutation that burrows deeper into lungs or triggers hyperinflammation could bring back the horrors of 2020. Overflowing hospitals, shortages of ventilators, triage medicine where doctors decide who lives or dies. Immune escape. This is the nightmare scenario: vaccines rendered useless, past infections offering no shield. Humanity would be stripped naked before the monster once more. Dr. Michael Osterholm, a top US epidemiologist, warned bluntly, people think the pandemic is over. That is the most dangerous lie of all. This virus is not done with us. Scenario 1: the silent spread. Omicron infected 90 million people in 10 weeks. But what if the next variant spreads even faster? What if it incubates silently? No fever, no cough, passing unseen from one host to another. By the time symptoms appear, cities would already be engulfed. Travel bans, lockdowns, collapsing supply chains. Déjà vu, but worse. Scenario 2: death returns. The hope that viruses get weaker over time is a myth. The 1918 flu returned in a second wave, deadlier than the first. What if COVID mutates to increase lethality? More lung scarring, multi-organ failure, fatal blood clots striking without warning. In India, Delta left patients suffocating outside hospitals begging for oxygen. In Ecuador, families abandoned bodies on sidewalks because morgues were overwhelmed. These were not medieval plagues. These were modern cities just months ago. Scenario 3: betrayal of immunity. Vaccines gave hope, but hope can be betrayed. In 2022, scientists in South Africa detected Omicron subvariants that slipped past immunity. In labs, antibodies that once neutralized the virus failed. Booster campaigns began like fire drills, but fatigue set in. Now imagine a variant with complete immune escape. Vaccinated, unvaccinated, it would make no difference. Humanity would be thrust back to the start. Governments would scramble for updated vaccines. Riots could erupt if supplies ran short. And mistrust in science would deepen into rage. History shows the danger. The Black Death of the 14th century mutated into waves that wiped out half of Europe. Ebola outbreaks in Africa repeatedly returned after seeming to fade. HIV has mutated for decades, evading a cure even as millions die. COVID belongs to the same cruel family of survivors, the forgotten host animals. Perhaps the most frightening fact is this: COVID is not confined to humans. It has been found in mink farms, white-tailed deer, even cats and dogs. In 2020, Denmark culled 17 million mink after the virus mutated inside them and jumped back to humans. Imagine a variant brewing silently in wild deer, mutating out of sight, and one day spilling back into human cities. It would arrive as something unrecognizable, something scientists never saw coming. Global preparedness, or the lack of it. The world has tools, MRI platforms, antiviral drugs, genomic tracking. But cracks are everywhere. Africa, fewer than 20% fully vaccinated. Southeast Asia, surveillance gaps leave blind spots for months. Europe and US public trust shattered, anti-vaccine protests raging. The greatest weakness is psychological. Humanity is exhausted. People crave normal life. A new mutation would meet not unity but rebellion. The economic horror. COVID cost the global economy $12.5 trillion according to the IMF. Airlines collapsed. Small businesses never reopened. Millions lost jobs. A new mutation could repeat the carnage. Stock markets in freefall. Inflation spikes. Supply chains choked. For ordinary families, it means hunger, eviction, and despair. The psychological toll. Even those who survive face shadows. Long COVID has left millions with brain fog, chronic fatigue, and organ damage. A mutation with stronger post-viral effects could create an entire generation of disabled survivors. And then there is fear itself. Fear that shatters trust, divides societies, fuels conspiracy theories. During the last pandemic waves, protests turned violent. Paris, Melbourne, Ottawa. The next wave could bring more than riots. It could bring civil breakdown. The political fallout. A new mutation would not only test health systems but also political stability. Leaders who declare the pandemic over could face backlash when deaths rise again. Governments might struggle to impose restrictions on populations already distrustful of authority. In countries with fragile democracies, this could fuel authoritarian crackdowns or even collapse regimes. The inequality factor. The first waves showed how unevenly the world responds to crisis. Wealthy nations hoarded vaccines while poorer countries waited. If a deadlier variant emerges, this divide will widen. Rich countries may shield themselves while the global south suffers catastrophic losses. Such inequality could trigger mass migrations, humanitarian crises, and global instability far beyond the virus itself. The biosecurity threat. There is also the possibility of mutation through laboratories or accidents. COVID research continues worldwide, and some facilities experiment with live strains. A single mistake, or deliberate misuse, could unleash a variant deadlier than anything nature creates. That means the next pandemic wave might not come from the wild, but from human hands. The healthcare system collapsed even before COVID. Many hospitals around the world ran at near capacity. Another deadly mutation could tip them into total collapse. Imagine doctors forced to choose who gets oxygen, nurses burning out, and entire hospitals shutting down from staph infections. This would not just affect COVID patients. Heart attacks, cancer treatments, and childbirth emergencies would all be left untreated, multiplying the death toll far beyond the virus itself. The global security angle. A severe new wave would not only cripple economies but also military readiness. If large portions of soldiers, pilots, or defense workers fall sick, nations could face sudden vulnerabilities. Adversaries might exploit the chaos, launching cyber attacks, territorial grabs, or proxy wars while rivals are distracted by the pandemic. A mutation, therefore, could trigger not just a health crisis but a geopolitical one, reshaping global security in unpredictable ways. The invisible fuse. The most frightening thing about COVID is not just its past, it is its potential future. Every human body it enters becomes a laboratory, a test tube where random mutations occur. Most mutations fail, but a handful give the virus an edgy, faster spread, deeper lung penetration, or evasion of immunity. Imagine a variant that incubates silently for a week, spreading through schools, subways, and offices before anyone realizes it is there. By the time the first fevers appear, millions could already be infected. Governments might scramble to impose lockdowns, but trust has eroded. Many people would resist, fueling protests and chaos. Hospitals, already fragile, would overflow. Oxygen would vanish from shelves. Doctors would face the same nightmare choices they once did: who gets saved, who is left behind. Families would again gather outside emergency rooms, begging for beds. And this time, there would be less patience, less compliance, more anger. A virus with such traits would not need to be deadliest. It would only need to be fast and invisible, slipping past society's defenses until it was too late. That is the true terror, a pandemic reborn in silence. The final warning. The question, what if COVID mutates again, is not speculation. It is inevitability. The only unknown is whether the next chapter will be a whisper or a scream. It could fade into the background as a mild seasonal illness, or it could re-emerge as a predator, deadlier, faster, immune to everything humanity throws at it. The pandemic changed the world once. If COVID mutates again, the world will be tested once more. And this time, the difference between survival and catastrophe will depend on what we choose to do now.